There isn't much we wouldn't do for someone we love.
My mom was a very independent woman, strong persona.
When it comes to Veronica Alcala's mom,
She knew what she wanted and when she wanted it.
and what she wanted was for her daughter to visit her every day.
My mother and I were very close.
Her mother moved into a long-term care facility after she was diagnosed with mild dementia.
I remember leaving the last day and telling her, you know what, Mom, I'll be back. I'll be back tomorrow. I'll be back tomorrow to do your hair, because I'd always dye her hair or comb it and curl it.
But when she went back the next day, she was turned away. Veronica was limited to visits through a window. COVID was here, and facilities across the country were shutting down.
At first, it was just soul crushing because I was unable to make any decisions about her care, and I was unable to do the things that I was doing every day.
Mary Nichols' mom is also at a long-term care facility, diagnosed with Alzheimer's. It's just one reason she started Texas Caregivers for Compromise in July.
It took me several weeks to get frustrated enough to begin the petition and start looking for other people like me, but it didn't take very long for me to find those people.
By August, Nichols said that petition had thousands of signatures. Texas Caregivers for Compromise then introduced a proposal for an essential caregiver program to Texas Health and Human Services. In September, Governor Greg Abbott announced nursing home facilities in the state could open back up for essential caregivers.
I really believe that this mental health crisis is on both sides of the facility walls. Families have endured such an excruciating level of pain and anxiety and uncertainty.
And as for the folks staying inside the facilities,
and it just breaks mine and other people's hearts to see that that they're cut off from the human touch.
Dr. David Murdy is a geriatrician with Baylor Scott and White.
Their family members want them to stay safe, but it is often the daughter, the husband, the spouse who can best interpret, reassure them, provide support to them. And when you cut people off from some of that, it can be devastating. It's not uncommon to see people decline faster under these kind of conditions than they might have if they had had more frequent contact with loved ones.
I think it's the hardest thing. It's it does play a big role with your mental health. The decline, I think it's the biggest, it's the worst. I believe they felt lonely, they felt forgotten.
A hope for any kind of contact became even more bleak when there was a COVID outbreak at Veronica's mom's facility over the summer. Her mom tested positive.
It was downhill from there. She could no longer use the phone. She could no longer call me. She could no longer speak when I spoke to her or when I would video chat. She was always asleep.
Veronica went about 6 months,
I believe it was 210 days.
without being by her side. On September 24th, the first day the governor allowed visits to resume, she was back in her mother's room.
To my surprise, my mom could no longer communicate. My mother could no longer move. She was just, it wasn't her anymore. It wasn't her anymore.
The next morning, her mother died.
It's very hard to deal with, especially when you've been attached to a family member or your parent for so long. And in that way, I miss her every day. There's not a point in time that I don't think about her. It's very hard, the anxiety, the mental anguish, the what if, what could I have done? Was this my fault? It's heartbreaking.
COVID has taken away so much, but in the loss, in the struggles both mentally and physically, Veronica found hope in one constant.
My family, my kids, they've taught me that you have to cherish every moment that you have. And I am so glad that I was able to be there when I was for my mother. And that's something that nobody could take away from me.